Good afternoon, everybody. My name is Carl. I'm a recovery coach here at Tap Recovery. Today is our Medding training meeting, and this article is by nextsteprecovery.com. So if you like this article, you can go to nextsteprecovery.com. So this article is Men's Addiction and Addiction Care Guide, everything you need to know. So addiction in men is uniquely challenging for those seeking long-lasting sobriety. As men use addictive substances, many factors can lead to dependency. Addiction is more than coping. It can result from any number of biological or genetics issues. As you start the path of recovery, we are at Next Step Recovery, what you know to know how men's addiction works. We'll cover some of your most pressing questions about addiction in males. It says, what is men's addiction? Is addiction different from men and women? Why do men get addictions? Why are common addictions in men? What challenges do men face in addiction care? What should I know before starting addiction treatment? Let's jump into another deep dive together by starting with the basics. So we'll go on to what is men's addiction? Men's addiction defines why and how dependencies specifically affect males. Addiction in men is unique due to biological traumas, cultural expectations, and other factors. These characteristics are confronted with gender-specific addiction treatments, such as men-only recovery programs. Men with addictions may have compulsive habits and around any number of substance things or activities. These habitual behaviors are difficult to give up. In this article, we'll be focusing on common disruptive forms of addiction in men. Men might have addiction if they continue behaviors despite negative consequences or social or work life, engage in frequent compulsive activities for unplanned amounts of time, and have loved ones that may define the behavior as overindulged, and experience notable emotional discomfort is abstaining from behavior, or affected by physical illness symptoms is not engaging in activity. And it goes on. Many other indicators may lead to advanced diagnosis of an addiction. In any case, a dependency on this level will continue to cause harm until qualified help intervenes. So this is our men training meeting. So it's not me being biased or sexist. This is our meeting for the men and, everybody as well. But, because men and women, I think this is my outlook on things is like we cope and deal with things differently, as men and women, so I think men can relate more to men and then women can more relate to women. But we all can learn from somebody, right? So we're going into the differences in addiction for men and versus women. Addiction harms all genders, but there are notable differences in impacts for men. So we're just kind of discussing that, pointing a couple of things. Men and women, to me, is equally as more the same. But as men and women, we definitely have different coping skills and we deal with things differently. Men's addiction are frequently used to mask physical pain, fit as socially, or to cope with extreme mental burdens. Common issues may include pressures to be masculine or physically righteous job roles. These lead to triggers for addiction. Women's addiction can come from body composition, social pressures, and coping. Common factors include lighter body weight, elevated chemical response to substance and addiction. Females experience higher rates of physical assault trauma. Addiction care focuses on a blend of biological environment experiences and other features. Men addiction treatment focuses on factors that often interact to cause addictions in males. Men may benefit from gender exclusive treatment if feeling like being emotionally open is a weakness, dealing with traumas you feel no one understands, like sexual abuse, your social circle increased your urge to engage in your addiction. Co-ed treatment is still a practical choice for anyone seeking treatment. However, a fine turn treatment plan for our clients' gender increase chances of lasting recovery. So, so as men and like seeking treatment, uh, as of men facility or a co-ed facility with men and women, me personally, I think men usually would need a men's facility because like a co-ed, that can eliminate, have a lot of distractions, right? Because you have the men and women trying to fraternize and you're not focusing on yourself, you're not focusing on what you have to do. It's usually a barrier when you have a co-ed facility. But I'm not saying that's a bad thing, but like if you want to succeed in your recovery and get clean and stay clean, you know, you have to focus on you more importantly, and you know, eliminate all distractions. So I think all men's facility is a good way to go. So we'll go into men's addiction care plan. So men's specific addiction programs target gender issues that prevent recovery. Addiction programs tend to be most effective when peers have similar challenges. Clients might have been in co-ed treatment in the past, while viable these spaces may make men fall into behaviors that inhibit their ability to confine their struggles. Men-only addiction care gives you a comfortable space to open up. Many clients find it easier to embrace vulnerability and feel that their experience are understood. To begin, you must first submit to clinical diagnosis and treatment before you can have true recovery. Many possibility of having an addiction can be very hard. Clients may be willing to accept treatment once they learn how addiction works. And that's very true. So for like men, you know, it's hard for us to open up more, to be vulnerable, to express ourselves, and dealing with trauma or childhood trauma, because a lot of this, you know, for me in the older days, like, you know, men ain't supposed to cry, we ain't supposed to express ourselves, you know, and a lot of people been brought up that way, you know, and that can keep us, you know, in addiction. That can keep us using drugs and alcohol. And if we don't open up and be honest and tell people how we really feel, we don't have to tell everybody, but we have to tell somebody, right? And that's what I learned. I have to tell somebody I trust and confide in. And that's for me. I joined a 12-step fellowship when I got clean, and I have a sponsor. So that's who I confide in, that's who I trust, and that's who I open up with. And it's a lot of it is freeing. You know, it might be uncomfortable, but you have to deal with uncomfortability. You know, to you know, I look at it like I already experienced it, right? So you know, I have to let it go. So letting it go is talking with my sponsor, putting on paper, and you know, letting it go. So it's very beneficial. It's a lot more freeing. You know, you lift off them burdens that you carry around with. As men, we can do that. You know, we put that pride and ego, and that can be very crucial to our recovery. Where are we at? Clients may be willing to accept treatment once they learn how addiction works. Yeah, you gotta find out how addiction works, and the first thing of surrendering you need help, you know, and admitting that we have a problem is the first step. Let's go to why men develop addictions. Addictions are the result of cross interactions between a mix of genetic abnormalities, mental traumas and experiences, environmental pressures, and influences. You should be aware that addictions are not caused by weakness. Genetics, cultural beliefs, and even physical brain damage all can lead to unhealthy behaviors. Men may be using their addiction to cope, or they may be hardwired to be susceptible to addictive behaviors. Unfortunately, many men may be in denial or see themselves as in control of their addiction. It is incorrect but common for addiction to be viewed as a moral feeling. This false perspective can cause the issue to go untreated and escalate. Addiction can and will send an individual into a downward spiral unless something is done. So, like, if we don't address it head on, if we don't, get it treated, right? Because we're never cured. We can treat our disease each day, but we have to address it. We can't keep on pushing it down. We can't brush it under the rug. We can't keep putting it on the back burner, right? Because that fuels our addiction, right? So we have to take it one step at a time, but keep, uncovering what's really going on with us. And as men, it's tough to do that at times, What's going on, brother? How you doing?
Good, how about you, man?
Good, man. This is our men in training meeting, and I have an article here that says Men, Addiction, and Addiction Care Guide. Everything you need to know. And we're right where
I was waiting over there, but nobody was in the front. So.
no was in the front.
Yeah.
Finally let you in. And what's your name?
Giovanni.
I was like, Giovanni's here.
Hey, everybody.
Nice seeing you again, Giovanni.
Thank you. Where are we?
And why men develop addictions. And that's like the third page in at the top. Let me see where I left off at. Maybe their addiction to cope with. All right. Unfortunately, many men, this false perception. Okay, we're on the next one here. I'm sorry about that. So we're going on to the common types of men's addiction. So some of the types that men have addiction. Identifying the addiction is one of the earliest steps in treating the problem behavior. Destructive habits come in many forms, but there are some dependencies that commonly lead to rehab treatment. Common addictions affecting men include substance abuse disorder, involves the overuse of state-altering substances such as drugs or alcohol. These are a few of the more common substance addictions. Here's some of them. Opiates, prescription painkillers like oxycodone, Vicodin, fentanyl, heroin, alcohol, marijuana, cocaine, and methamphetamines. And it goes on to say dual diagnosis involves at least one addiction and mental health condition. Co-occurring disorders require diagnosis and treatment to prevent relapse. Of course, men can be afflicted with other dependency issues. Addiction to sex, gambling, and even food can be a burden on your health and well-being. Very true. With all addictions, a man's road to recovery will have a few blockades and detours. So it talks about, it can be many types of addictions. It doesn't always mean about drugs and alcohol, which I had a little perspective on when I was using drugs and alcohol, right? Because I thought that was like the problem, but it's a lot bigger than just the drugs. Right? It's my behaviors, my thoughts, my thinking, my actions. What I say, how I say things. That all correlates with addiction. Because we can get the drugs and alcohol out of our system, right? But we can still be living the way we used to live in an active addiction. And that's I got clean this time. That's one thing I didn't want to do. Be absent from all drugs, and then live and live. I always say be clean but live dirty. That doesn't mix. It can always, you live in the type of way, it's not good, right? It can lead you back to relapse. Yeah. So I definitely, cut people, places, and things, and there's a lot of things you have to do for your recovery, but it must be done.
Do whatever it takes.
Yeah, you gotta do whatever it takes, man. Because I did whatever it takes to get drugs and alcohol. I did whatever it takes to get what I needed. So I kind of have to do the same thing for my recovery as well. If I want to keep what I have, man, but it's about, for me, it's about giving back as well today. I'm not a selfish person, right? So we'll go to the next one is Problem males face in addiction and treatment. All right. Males clients have many reasons for not seeking or fully engage in addiction care. Common issues that disrupt prevent male addiction treatment include moments of happiness, can lead to denial of addiction or belief that you are cured. Addiction is chronic and lifelong. With no cure, struggles always return. Addiction treatment helps you manage the condition to keep it from stealing your life. So, you get clean, stuff like that, and then life turns good. We got a life, we got work, we got a job, we got family, we got friends. And then I've seen and heard a lot of times it's like, I'm good, I'm okay, I got my life back, I got this and stuff like that. And then don't further along in recovery, don't do the necessary basic things that we need to do. And then eventually, it might be not today, might not be tomorrow, even months down the road, even years down the road, but eventually it can lead you back to using drugs and alcohol because we have to keep this in check on a daily basis. It's very important. Very, very important. I have to do the necessary things I need to do to stay clean. Belief in controlling substance use can keep men from submitting fully to the guidance and support of rehab. Male bravado, I don't know what that word is reinforced from youth until hood. In many cultures, clients must learn to be open without feeling inferior. Belief in controlling substance use. So we think we can control it. We're not doing as much as this person, whatever we tell ourselves that we're okay, but we're still damaging your life at the same time. That denial, not and deflecting and not really admitting that we have a problem fuels our addiction. Reduced engagement in treatment may come from being unwilling to express traumas or seem weak. This can happen often in co-ed programs. Men-only programs help, but vulnerability is still difficult to embrace for many clients. Yep. We're talking about that earlier. Like, if men go to treatment, I think it's better off if men go to all men's facility because, like a co-ed facility, you can get caught up with women and fraternizing, and you're not focused on what you have to do. I've seen it and I witnessed it plenty of times. You're keeping the focus off of you. It's, and that can boost your pride and ego it talks about like opening up and being vulnerable and stuff like that. Because when you have women present, some men are like, with that pride and ego, we don't want to show a sign of weakness, that is not good. At times that is not good. Co-occurring disorders may be undiagnosed, which can inhibit treatment. Clients can get care for addiction and recover. But any untreated mental conditions may trigger relapse. Dual diagnosis treatment is the best way to tackle this issue. Even if it goes well, treatment must be continuous for the best chances of recovery. So it talks about co-occurring disorders, right? So this goes for men and women. Some of us don't want to treat the mental illness aspect of it, the mental part of it. Sometimes medication is necessary. I'm on medication. I'll be open and honest. I have to take something for my anxiety and stuff like that. Not non-narcotic, you know what I mean? And because we're trying to eliminate barriers, to prevent relapse. You know what I mean? And a lot of people don't want to address going to therapy, counseling, and dealing with whatever's going on the mental aspect, and eventually that can lead to using. So we have to treat both. We have both. We have to treat both. We can't just treat one without the other. It just doesn't work. But it's very important to address co-occurring disorders. And some people have this perception of it, like maybe feeling less than or feeling something something wrong with us. But we have to treat it, because if we don't, it usually doesn't end up good. How men's addiction is treated in the continuum of care. Treatment for addiction in men involves a series of programs for each part of recovery. The continuum of addiction care is a connective web that networks recovery services together, helps men avoid gaps in treatment, and prevents relapse. Continuum of care programs are grouped into the following stages. Point five, early intervention services. Level one, outpatient services. Level two, intensive outpatient or partial hospitalization services. Level three, residential or inpatient treatment services. Level four, medical managed intensive inpatient treatment services. All treatment begins with diagnosis and substance detoxification if needed. You would then move through the continuum, stepping down into less intensive care. Some men may show traits of risk factors for addiction without an official diagnosis. Level of 0.5 intervention allows professionals to monitor you in case you develop a habit. A habit entry into treatment depends on the severity of addiction of your condition. Level two above may be evaluated for the safety of more unstable clients. Others may be able to do part-time treatment as level one or two outpatient. Eventually, sober clients are released into the full independence. However, sobriety is a lifelong process. You will still find yourself active in community support groups. Relapse or roadblocks to progress are not uncommon, resulting in step up into your higher levels of treatment. Recovery is not a straight path, but the insured detours will not stop the journey. And I'll touch on a little bit like what was I going to say? Sometimes, we try to get diagnosed. This is, I think, very important too. For me too, it's like I went to the doctor and I would tell him things just to get what I wanted, medication wise, and I would get misdiagnosed. Right? I'm under the influence, and I'm telling doctor this because I'm just giving misinformation, right? And so I get medication, and and sometimes a lot of times I get misdiagnosed. How can we diagnose somebody? I'm not a doctor, just a recovery coach, but my point of view of it, like, how can I diagnose somebody when they're under influence and they're giving me misinformation, right? And so we get a lot of misdiagnosis, right? And we're putting on certain medications that we ain't supposed to put on, So I think the best way is when we get clean and sober, and there's like step down programs, right? And it's very, if it's detox, then it's outpatient, laws and other things, IOP, all that kind of stuff. It's very important. Like, there are steps of recovery, and it helps you, I think, in a way that, because I didn't have any coping skills, I didn't have structure is a main thing for me. I didn't have structure. I was always doing what I wanted to do, right? I didn't follow the rules, or I didn't follow any direction, so that's very important. I have some structure in life is definitely key. And talks about it's an ongoing process, and there's support groups. I go to 12-step meetings. It's something just like this, people and stuff like that. A lot of support. Have you ever been misdiagnosed or went to doctors and stuff before? Or yeah.
I don't think misdiagnosed. I don't think so. Maybe.
Yeah. No, I'm just saying sometimes it's accurate, but like I'm thinking in the situation of somebody being under influence and doing, having these behaviors and stuff like that. A lot of us can get misdiagnosed, and a lot of us are co-occurring. We have mental aspect and addictions. It's very important to treat that. And sometimes we got to figure out, this is what I'll touch on too, is what do we treat first, right? So for me, I know like it changes by the individual. Sometimes we have to treat the mental aspect of it before the addiction, because that's more what the person needs. Sometimes we got to treat the addiction first, then we treat the mental aspect of it. So it changes by the person. We'll go to treatments used for men and addiction. Programs may include a blend of treatment types for each client. Detoxification is essential for any substance user. Abstinence is expected in most cases, and you may be assisted with detox medication to prevent lethal withdrawal. Post-detox treatments commonly use therapy, peer support, and wellness services. The structure surrounding these treatments varies based on the program. Treatment generally fall into one of these common programs types. Inpatient treatment services for clients is hazardous condition hospitalization may occur to safeguard the health and safety of the client and others around them. This usually includes around-the-clock attention. Yeah, inpatient treatment. Sometimes a person has drank so much or used so much medication, sometimes they have to go to the hospital because, you know what I mean, keeping them in treatment can be what they need. They need a higher level of care. So a hospital, huh?
Like an overdose?
Yeah, they're probably overdosing, or usually that's first before they go to inpatient treatment. But like, usually somebody's too intoxicated with drugs and alcohol. They have to see 24-hour care in a hospital, stuff like that. Then get medically cleared from there to go into treatment. You know what I mean? Because you don't want to go into treatment and they won't allow you if it's like you're way too much intoxicated. Yeah. Very important to seek to the hospital first before anything.
Yeah.
Intensive outpatient programs, IOP, for clients who need structure to build a sober lifestyle. There we go, structure. Clients show up to schedule part-time treatments, but the clients live off of premises either at home or in an outpatient residence. Outpatient recovery homes for men who need to live away from the home and receive peer support. Sober living programs distance clients from triggers as they navigate independent sobriety. So it talks about outpatient recovery homes. So it's like after you go to treatment, you have a chance to go to sober living houses. Sometimes, being away from your environment, sometimes your family, your friends, you need to get out and be in a sober living, to get away for a little while after treatment, and I see a lot of people do it and it works, and the sober living is like a structured environment. You have like house meetings, you have random drug tests, a lot of places, a lot of houses should do that. Some don't, but it's a house, but it's more structure based, more recovery based. So I think it's very nice to go when you get out of treatment to go to one of them houses. And we'll note here we help with sober living funding, so we can help with the month's rent. So when people get out of treatment, as long as you're a Cumberland County resident, we can get you in a sober living house and we pay for a month's rent. As long as we got the funding, and that, which I think is awesome. So these are some of the common methods for treating men's addiction, and we'll end it right there. This is a great article, and I think not to be biased or discredit for men and women, but like it's more easier, I think, for men to open up to other men sometimes, or to when don't have women around, because that pride and ego can set in, and so we have to learn to open up and be honest and like address what's really going on with us. If we don't, I think we're not going to get better. We have to. I've learned I have to get to the root of the problem and address it. If I don't, then I can just keep on spiraling. I can keep on that hamster wheel of, fueling the fire of addiction. But appreciate you coming again, man. And that was our men in training meeting for the day. Until next time, I'm Carl, Recovery Coach Shot Cap Recovery, and I'll see you next time.
I was trying to make it on 2